Coming up next on Arizona Horizon, the governor released her plan to expand Medicaid this week. Now it's up to the legislature to decide if the plan will be implemented. We'll hear from lawmakers on both sides of the issue. Also tonight, how do you measure the value of the arts on society? Those stories next on Arizona Horizon.
Arizona Horizon is made possible by contributions from the Friends of Eight, members of your Arizona PBS station. Thank you.
Good evening and welcome to Arizona Horizon. I'm Ted Simons. Governor Brewer this week announced draft legislation to expand Arizona's health insurance plan for the poor. But the plan needs the legislature's approval, and that's far from a done deal. Here to discuss the legislation is Representative Debbie McCune Davis, who is in favor of the bill, and speaking against the governor's plan is Representative John Kavanaugh. Good to have you both here. Thanks for joining us.
Thank you.
Why is this good for Arizona?
We need to restore health care to a group of folks in Arizona, and we have a great opportunity with the Affordable Care Act. We have the ability to do what the states around us are doing, and that is to build a system of access to care for everybody in Arizona, and it's a common sense thing. We simply need to put something in place that allows people to get access to health insurance that provides access to health care.
So what's wrong with this plan?
Well, first of all, America can't afford this, and Arizona is part of America. This is a budget-busting proposal. In addition, there's grave risks to the Arizona budget. If some of the parts that supposedly fund this collapse, it could expose us to over $1 billion worth of extra expenses. Its constitutionality is highly questionable, and there's a better way.
I want to go back to the idea regarding the state can't afford it and the federal government can't afford it. We had legislative leadership on earlier in the week, and that's basically what they said as well. Take a listen.
Let's think about it for a second. What we're asking truly is that we assess and unfairly burden not just today's taxpayers, but generations of taxpayers to come to pay for what? Current year health care. That's really what it boils down to. Because 40 cents of every dollar at federal level is paid for how? It's borrowed.
We all recognize there's a crisis. We recognize there's an emergency room problem. We recognize there's a uninsured problem that's out there. The question is, do you end up moving forward on billions of dollars in federal dollars that don't exist that come to Arizona? And that's really where the debate is.
That indeed is where the debate is. There are those, and we heard Representative Kavanaugh say it, the federal government simply can't be counted on to cooperate here. How do you respond to that?
Well, I'm going to go back 20 years to when Arizona adopted Medicaid, or our access plan. And the federal government stepped up and participated as a partner in that process. And they have been at the table with money every year since. I think they've been a reliable partner, and I think they will be going forward. The idea of the Affordable Care Act going forward is to really improve the situation nationally and try to bring the cost of health care down while creating access for all. The idea that we can't afford it has to be counterposed with a question of, can we afford not to do this? We have obligations to meet, and this is one of the areas Arizona has to step up.
We've heard about this unintended tax, the uncompensated care tax, and the question does remain, if this doesn't pass, if this doesn't happen, can we afford it?
Look, the federal government runs a yearly deficit of $1.1 trillion. Federal debt is approaching $17 trillion. If you add to that the unfunded liabilities the federal government has to Social Security, to Medicare, and to federal pensions, the total government debt is $88.6 trillion. That's over 500% GDP. We are on the road to Greece. This type of irresponsible spending cannot go on. We're going to be a third-tier country.
Is there not, though, a circuit breaker, as the governor calls it, whereas if the federal government gets below the 80% agreed to line level there, ba-boom, it's over?
There's a circuit breaker for Arizona, but it's the federal government that's paying all of this. That's how they're getting us in. They're broke. They can't afford this wild spending. But as to Arizona, there are problems here, too. If the match goes down to 80%, even with the circuit breaker, that adds $225 million to our budget down the road. If, in fact, the bed tax, which the Simpson-Bowles Budget Reduction Commission characterized as a gimmick used to draw down money, and it is a gimmick. They said get rid of it because it would save the federal government $44 billion a year. If the feds wake up and realize they have to start saving money and they get rid of this bed tax, then we will be responsible for what it raises in the federal match. If we pass this bill, that's $1.6 billion a year. It busts our budget wide open.
Respond, please.
I find myself in a very funny position, taking the governor's side over what is essentially a fight within the Republican caucus. There are Republicans who know what's going on in the economy in Arizona, who know that since the cuts have been made to health care in Arizona and the Prop 204 population frozen, that there is a direct correlation between the number of people taken off of health care and the uncompensated care in our hospitals. The issue is relevant to where we are today, not theoretically where we are down the road.
Our hospitals are making profits. They're not making profits as large as they were in the past. That they just gave the Betsy Bayless, the administrator of our poverty hospital, a salary bump to $500,000 a year. There's plenty of money. It's the federal government which hasn't got the money. And beyond that, this program will add 400,000 people to the existing 1.2 million people in Arizona on indigent health care. What is that going to do to doctor's office visits and hospital care? Can you throw that many people into a healthcare system and not totally overburden and overwhelm it? I don't think so.
What do you make of that?
Well, it's an overstatement. This is access to care. It doesn't put people in doctor's offices. It gives them access to preventive care and to services when they need them. People who are sick seek out that care. The question is, are the providers providing that care actually being paid for it? Or are we putting the burden on the community? Because what we did with the 204 population was simply shift the costs to our community partners.
The governor says that the Republican Party will be blamed if these people lose coverage and if the people that could get coverage are being left out on the street, left to their own. Republican precincts, though, seem to feel otherwise. This is quite a shift, quite a split, I should say, in the Republican Party. But does she have a point? If folks wind up saying, wait a minute, where's my coverage? They're going to be looking at you.
Well, we're not talking about anybody losing coverage under this system. We're talking about not expanding the system to 133% of the poverty
But there will
level.
be some who will lose coverage if they're not on January 1st.
Nobody will lose coverage. The only people that are, the only program that's frozen are the single adult, childless adults, and nobody's being thrown off. Our proposal is maintain the status quo and reform health care so it can be affordable.
No one will be thrown off.
Yes, because they've already been thrown off to a substantial degree. And what will happen is, as we move into the new year and we don't come online with Medicaid alignment, expansion, whatever you want to call it, the amount that the federal government matches the state dollars will change, and there will be a burden. And the folks who are opposing this, for the most part, would like to see us deliver health services to less people. So I think it moves in the direction of those who simply want to eliminate the program.
Back to leadership we had on earlier in the week, Speaker Tobin talked about the fact that there are a lot of folks debating this issue. What he's worried about is that no one seems to be speaking for the taxpayers.
Well, we already know that the folks who need to get the benefits have a place at the table. Where's the place at the table for the folks who are paying all the bills? And I think that's really where this, I defer to the president, but I think in my caucus they're starting to say, well, yeah, I mean, what's happened to the taxpayer?
Legitimate question there. What's happening to the taxpayer?
Oh, I think the governor makes the case when she says do the math. When she suggests that the state can put in the number of dollars that can be raised through the assessment, that's matched on a 10-to-1 basis with the federal match, that where you go with that, it's jobs, better services, and a boost to the economy. I think that's where the taxpayers make out.
Most efficient way to meet Arizona's medical needs. That's how this is described, especially with all these matching funds. Are they wrong?
The most efficient way is tort reform. The most efficient way is to give people a choice of different levels of insurance policies with different benefits. The most efficient way is to have nationwide competition between insurance companies to lower rates. The most efficient way is to have co-pays to discourage people from unnecessarily going to the doctors. Tax deductions so people can buy their own health insurance. That's the free market method that made this country great. And this is a massive socialized medicine Obamacare scheme which puts 46% of the population into government health care, which is unsustainable, which you can't even get half the doctors, or 1/3 of the doctors wouldn't even take these patients because the payments are terrible. It's destroying the healthcare system, and we're printing money and we're borrowing from China to pay for this disaster.
Free market makes better sense than this.
Well, I think Mr. Kavanaugh's statements are overstatements at best. First of all, Arizona's Medicaid system is done through a public-private partnership. We have privatized it. It's working well, and it's recognized across the country. And the concept of free market doesn't work with an aging population. You cannot find underwriters who are going to take the older population and give them a fair shake in terms of coverage. The bottom line is that's just rhetoric. We're in Arizona today. We have to address Arizona's problems, and we have a solution available.
Using that reasoning, public welfare is a private thing because when they get the public money, they spend it in private stores. This is public money and a massive takeover of a large segment of our economy, and it is driving the left standard of care down, and it's overcrowding everything.
Before we go, I want you to hear, we had President Michael Crow, ASU President Michael Crow on the program, because he came out with a statement on this as well. He basically said that this is the right thing to do right now.
The core value is that everybody should have access to health and happiness and advancement and social mobility. And these investments that are configured in this particular strategy help that to occur for the foreseeable future. There may be better ways to do it in the long run, better ways to finance it in the long run, but we're not at the long run yet. This is the way to do it right now.
Pragmatism. We can debate ideology all we want, but when you talk about matching funds, when you talk about the needs of hospitals, the needs of patients, the needs of an aging population, the whole 9 yards, this makes the best sense. How do you respond?
It makes no sense, and the older people are on Medicare, and nobody's touching Medicare whatsoever. The solution is tort reform, so you don't have expensive lawsuits and defensive medicine. More insurance plan choice. Obamacare says everyone gets a platinum policy. You can have cheaper policies that cover less things. The other things I said, more competition, co-pays, let people do tax deductions. That's the solution that's worked for America. This is the wrong way, and it's bankrupting this country, and it's making my grandchild pay the debts of today. That's bad.
Final word.
I hear from constituents who have medical treatments that they need today, and we have to offer them a solution. So far, we've put some freezes on programs, and we've told them that they basically have to take care of themselves. Medicaid eligibility at 100% of federal poverty under 204 is $15,000 a year. If you have exceptional medical bills, you will not get treated in this state. You will not find access to treatment. That's what we're trying to fix.
Okay, we need to stop it right there. Very good. Good discussion. Good to have you both here. Thanks for joining us.
Thank you.
Appreciation of the arts extends beyond personal enjoyment. It impacts education, the economy, and a variety of other factors that make up society. Here to talk about the value of a healthy arts community is Ben Cameron, Program Director for the Arts at the Doris Duke Charitable Foundation in New York. Cameron is also the inaugural Thought Leader in Residence at the Virginia G. Piper Charitable Trust in Phoenix. That's quite a title for you.
I'm very grateful to be here.
Thank you so much for joining. We certainly appreciate it. The status of the arts, the status of arts organizations. The world is going pretty fast right now. How are the arts holding up?
The arts are in a very stressful time right now, nationwide, everywhere you look. Contributed revenues are down in many locations. Individual contributions are down. Corporate giving's entered a kind of free fall, and people are stressed for audiences. But as you know, there's so many stresses around communications and how we talk to each other in this country. We're seeing bookstores close. We're seeing newspapers close. We're seeing television coverage radically changed. The stresses the arts are facing are very much part of that same environment.
So how do arts organizations, arts groups, how do you better adapt? How do you reinvent?
It's the biggest question. You've just nailed it right on the head right now. I think what we're beginning to appreciate is the institutions we were really building for the last 40 or 50 years just assumed that our job was to produce performances for people to come watch. And while arts attendance in this country is eroding at an alarming rate in some cases, what we call arts participation, which are people singing in choirs, making their own movies. Do you know a 14-year-old girl that's not making movies now? I doubt you do. Making movies, writing their own poetry, that's exploding at an exponential rate. So I think arts organizations are beginning to ask, how can we expand our vision to embrace and include that participation as well as our production?
By including that participation, how do you make a business model out of that? Because that's personal fulfillment, personal enjoyment. How do you get X's and O's out of that?
Well, let me give you an example. There's a program in Baltimore, Maryland, called the Rusty Musicians Program. Now, the Baltimore Symphony is one of the great symphonies in the country. They held auditions for people that grew up playing the violin, playing the clarinet, but who are now doctors and lawyers and accountants and more. They're avocational musicians now. And they said, would you like to play with the full symphony? They auditioned. They chose the equivalent of another symphony, and at a particular concert, the Rusty musicians played right alongside the major musicians. What they found in that process was not only were the musicians themselves inspired by the dedication and the passion that the Rusty musicians brought, but whole new audiences showed up to see their friends or their boss play. A lot of people who had never been in the symphony thought, oh my Lord, I've never seen this. I like this. I'm going to come back. Classes began to expand, and rather than sort of taking focus away, new revenues, new contributions, new audiences began to follow in its wake. So this reinvention may be opening the door to new forms of support.
Basically, it's a new way of recruiting a new audience.
Well, it's a new way of acknowledging that arts experiences are meaningful and that we can either consume delight or we can find delight from participation. And if you look at it sort of like a spectrum, we focused only on one end of what the arts can be. And now it's the opportunity to say, can we broaden our minds? Instead of thinking of ourselves as arts organizations, what if we think of ourselves as platforms aggregating creative energy? That's a huge new opportunity for us.
Will that platform, though, allow for the best to become the best? I mean, we got Rusty musicians and we got 14-year-olds making videos, but where is the next James Cameron? Where is the next Cleveland Symphony? I mean, you know what I mean? How does the best become the best in that kind of an environment?
Well, again, I think we always think of the arts as a kind of ecological system. And at one end, there will always be those organizations who are solely dedicated to high performance of the highest caliber. The Metropolitan Opera will probably never have the equivalent of a Rusty Musicians program. The great schools like Juilliard will continue to feed into that system, but I think, again, many of us who are the best started in the most unconventional places. You know, I grew up in rural North Carolina. And where I grew up, dancing to us meant they closed Main Street every Wednesday, and we danced in Main Street. And then there was this thing called Columbia Concerts. Then I remember seeing Isaac Stern and Leontine Price in my high school auditorium before I was 8 years old. So these things that we've thought about as being mutually exclusive aren't. And I think what we're looking at is a broader range of participation. But the level is going to get higher and higher and higher. It's not unlike athletics. You know, 50 years ago, athletics were not in the public schools. Not everybody did it. But now it's part of our fabric. And look at the achievement level of athletes, which keeps skyrocketing with every successive generation. The same's going to happen in the arts.
Talk about the value of the arts into making a place, to making a there.
Well, I'd say this really means three things for us. Number one, we all know that you put artists in a neighborhood and it brings the neighborhood to life. As a New Yorker, we see this all the time. Artists move in where there are abandoned warehouses, abandoned storefronts. The next thing you know, it's the most expensive real estate in town. The artists can't afford to stay there, and they've brought new life to the community. Beyond that, I think the arts also have a huge economic impact. There are reports coming out here in Arizona any minute that says that the arts accounted for more than $500 million worth of economic activity in Arizona last year, which is a really phenomenal amount. And in Arizona, and in Philadelphia last year, it was $3.3 billion. Additionally, I think what's most important, the arts teach us to listen to each other, to aspire to be to each other. They formed social bonds together. And for me, as someone who travels around 20 days out of a month and many times, I hardly know what city I'm in if I didn't look at my plane ticket. I get off in many cities and I see the same fast foods, the same hotels, the same big box retailers, and it's the arts that distinguish one city from another and give it personality.
We have lawmakers on this program all the time debating all sorts of issues. The idea of funding the arts would be a hard sell for a number of these folks. I'm a lawmaker. Convince me that state funds, which are hard to come by these days, need to be somehow appropriated to the arts.
Well, I'd say two things to you. Number one, your voters want them. Gallup poll after Gallup poll after Gallup poll for generations have said, I want the arts and I'm willing to pay for them, and I especially want my kids to pay for them. So if you're listening to public opinion, this is a no-brainer. On top of that, though, I think the trap lawmakers get into in this is to perceive the arts as only a sort of painting on the wall, when what we really know is when you support the arts. I just came back from St. Louis, where I talked to a man who just, with a Shakespeare company there, who mounted a production of Romeo and Juliet in the streets that separated the Latino neighborhood from the African American neighborhood. Members of both those communities were in the play. Members from both those communities came to see the play. The tensions that had separated those two communities are now diffused, and they're engaged in conversation for the first time. What you've achieved is an urban renewal and a community revitalization. That's what you funded when you funded the arts. You didn't fund a painting on the wall.
West Side Story there in St. Louis.
Absolutely.
You've got about 30 seconds left. Are we on the right track in Phoenix, or do we have a ways to go?
Everybody's got a way to go, but you are very much on the right track. We did a community forum here last night that was a full house. There's a fantastic woman named Kimber, whose last name I'm
Kimber Lanning, we've had her on the show many times.
Oh, my Lord. I would like to clone her and put her around. I'm totally in love. The young leadership and the young energy and the recognition that young people want to live where there's a creative energy is on the ascendant, and she's leading the charge, and you guys are in great shape.
Well, it's good to have you on. Your enthusiasm is very much appreciated. Good to have you here.
My pleasure.
And that is it for now. I'm Ted Simons. Thank you so much for joining us. You have a great evening.
Arizona Horizon is made possible by contributions from the Friends of Eight, members of your Arizona PBS station. Thank you.